So Jeff, what should patients expect from treatment? What do you tell patients, or what do you think family practitioners should tell their patients about what they should expect from treatment for major depressive disorder?
I think that the most important thing of all is your relationship with your doctor, with the provider that's treating you. You need to know that you can turn to your provider for support. You can turn to your provider if you're feeling overwhelmed, if you have questions about the medication, if you have side effects. And you need to have your provider be available in a way where you're not afraid to call him or her, where they want you to be a full participating partner in the whole treatment process. And that means they need to spend enough time with you to be able to discern whether there are side effects that are a problem, or what to do about the side effects, or whether the medication is effective enough. And that means that they need to spend enough time with you in appointments. They need to see you in follow-up, probably weekly if you have a major depressive episode that's part of a major depressive disorder, or at least every other week. And you have to tailor it depending on what the patient needs. And so much of depression is appropriately treated by primary care doctors, but they can take it just so far. So if I have friends or relatives or patients who have come to me with questions about whether they're getting adequate treatment with their primary care doctor, the basic thing to know, and for primary care doctors to know, is that if it gets complicated, if you try an antidepressant medicine and it's not working, and you need to use higher doses, or you need to try different medications or combinations of medicines, then you need to refer that patient to a specialist. And patients need to know that too, so that they can ask for that kind of referral.
And as you said, I think it's very important that patients expect that the psychiatrist will spend at least an hour with them the first time they meet, and probably a good 20 minutes to half an hour on every subsequent appointment, and be available, especially, as you said, for concerns about side effects in between.
Sure. I mean, one of the most common reasons patients don't follow through with antidepressant treatment is they're having side effects that aren't being adequately addressed. And we can deal with side effects if we pay attention to them, either by decreasing the dose of the medication and increasing it more slowly in smaller doses, or changing to a different medication that is not likely to give that kind of side effect. So if we work with side effects, we can get to a point where we have the right medication, where there aren't serious side effect problems. Maybe they're minor issues, sort of like minor symptoms that may still be there if you don't have a complete remission, but they're not a problem. They don't interfere with your quality of life or your everyday functioning at work or at home, and so on.
Absolutely.
Yeah.
I think the other thing that patients should expect from their psychiatrist is education. And as we've been trying to do in our conversation, thinking about and then sharing with patients something about their illness. What's the cause? What are the treatment options? What are the risks of not engaging in treatment? As we've discussed, those risks are significant. And so I think patients should have an expectation that they will be educated about their illness and about their treatment, and that they'll have an ongoing conversation with their doctor about that.
Sure. And we know that a lot of times patients have to change doctors if their insurance coverage changes, or they move to a different area, and they need to know about their condition and treatment so they can take that with them. And we know that treatment outcomes are better if there's a partnership. And we know that patients understand their problem and what it needs to be helped. I've had many times with patients where, in the course of working with them, after they have become really very knowledgeable about what's going on and what treatments can do, or side effects that can occur, we're trying to figure out what to do in terms of a next step with medication treatment. And one of my patients will suggest something that makes the most sense as a next step. And as a result, we have more effective and better outcomes.